Good afternoon, everybody. Welcome to this UK FPO webinar. Apologies for the slightly late start. We have had a few technical issues behind the scenes, but I think we're ready to go now. For those of you who've attended before, you'll know that we try and run a varied programme, presenting things that will be useful for foundation doctors and trainers. One of the important parts of foundation training is starting out on a leadership journey. And we're very pleased today to have a webinar based around leadership. I'm very pleased to say we've got some experts from the Faculty of Medical Leadership and Management come to talk, and they've brought a few guests along, some of whom I think have been or are current foundation doctors. Main presenters are Sharia Khan and Kirsten Ahmet from the FMLM, and I will pass you over to them in a moment. But I will just say webinar is going to be recorded, will be available on the UK FPO website along with all the previous webinars shortly. And we will be running Q&A. If you put any questions in the Q&A, we'll have a session at the end and go through the answers. So I'll hand you over to our presenters.
Great, thanks very much, Tony. Hi, everyone. Thanks for joining the webinar this afternoon. We're really looking forward to presenting to you and hearing back from you based on what you hear from us today. Tamika's very kindly offered to share the slides. We've got a few slides, but don't worry, it's not going to be death by PowerPoint because we've got a number of people here to present to you this afternoon and that you can ask questions of towards the end of the session. Just to introduce myself, my name is Kirsten Ahmet. I'm the Director of Research at the Faculty of Medical Leadership and Management, and I've been involved in the organisation from the very early days. I was going to ask each person to introduce themselves. Tamika, is the presentation up or can I just not see it? Okay, well, Tamika's sorting that. Shrey, can I ask you to introduce yourself to the group?
Yes, hi, cheers, Kirsten. So hi, everyone. My name's Sharia Khan. I'm currently about to enter ST1 training. At this moment in time, I'm the Clinical Fellow with the Faculty of Medical Leadership and Management, as well as NHS England. So I was fairly recently a foundation trainee, so hopefully I can give people some good insights.
Terrific. Thank you very much, Shez. And Jamie, can I ask you to introduce yourself?
Sure. Hi everyone, my name is Jamie Smith. I'm a public health registrar in London at the moment, and previously, so last year, I was in Sheriar's position and I was the clinical fellow within the FMLM.
Brilliant, thanks Jamie. And Josie?
I'm Josie Cheese.
Josie, we can't hear you. You're very quiet. While you're sorting your sound, I'm going to come to Ria. Ria, would you like to introduce yourself?
Hi everyone, I'm Ria Vandari. I'm the co-chair of the Medical Student Steering Group at FMLM and a fourth-year medic at Nottingham.
Fantastic, thanks Ria. So just about to enter the foundation years. Josie, back to you.
Hear me?
You're very faint.
Goodness, I have no idea why. Is it meaningful when I speak?
We can just hear you. Just say a couple of sentences and we'll keep going.
Right. I'll dial in as well so that later on I can kind of tag team with my phone. I'm Josie Cheetham. I'm in the last 2 months of being a GP registrar in Wales. I was a foundation doctor in West Midlands back 8 years ago, and I'm currently the chair of the Faculty of Medical Management Steering Group.
Terrific. Thanks very much, Josie. So Tamika, if you can move to the next slide, you'll see a little bit more information about each of us, and we're going to have our contact details at the end as well, so you can get in touch with us if you would like. Next slide, please, Tamika. So what we're going to talk about today is several things. One is to introduce you to the Faculty of Medical Leadership and Management's leadership and management standards for medical professionals. We're going to share a bit around the research evidence that's underpinning why medical leadership and why leadership in general actually matters. We're going to share with you some resources that you're able to access after the webinar to learn more about leadership development, and some very practical guidance in terms of what you can do in terms of developing your leadership or supporting others to develop their leadership during the foundation years. But most importantly, we've got this rather austere group of doctors and medical students together to share some of their own personal reflections and insights and top tips in terms of their leadership development. I think there's always something very valuable about actually hearing from people that have been there and done that, rather than just sort of espousing a lot of theories at people. So next slide, please, Tamika. So you may or may not be familiar with the faculty. We've been around for about 12 years now, and we were set up by the Medical Royal Colleges across the UK, largely in recognition that actually leadership is really important. Leadership needs to be embedded as part of doctors' training at all career stages, and is a sort of ongoing process of learning and application right throughout your career. So we're here really about to promote excellence in leadership and drive continuous improvement for health and healthcare. We're not exclusively just a club. This is about actually making an impact to the patient at the end of the day. And we do several things. One is around professionalising medical leadership and management, and I'll talk about the standards in a moment. We also try and improve the quality of leadership and leadership development through evidence-based research and application of that research. And we also do a lot in terms of leadership development, and some of my colleagues are going to be talking about their own experiences on formal programs and otherwise. So that's about FMLM. Next slide, please, Tamika. And I just want to introduce the leadership and management standards, because you may or may not be familiar with these standards. They map across to frameworks and models that you might be familiar with. So, for example, the medical leadership competency framework, the healthcare leadership model, and there's many other frameworks, including the GMC's generic professional capabilities, that these standards actually map very well to. And there's several domains. You can have a bit more of a read of each of these standards, but probably the domains that apply most to you in terms of your development as foundation doctors, and for those that are supporting the development of foundation doctors, is around the self domain and the team domain, because those are things that are really most relevant to you, right now at this particular stage of your career. So undertaking activities, reflection that is going to help develop your own self-awareness and apply for your development, developing resilience, using your drive and energy appropriately and in ways that don't completely exhaust you, but also importantly working with a team. So how do you effectively work with a multi-professional team in healthcare in various different settings these days, but also how do you work across teams? Because as many of you will know and be aware of from your own experience, is that the teamwork doesn't just happen within sort of department boundaries or just in organizational boundaries. It's much more spread across the system now if we really want to improve care for patients. But there's other domains, including about the organization and about the system. So those kind of go to more of the corporate, I guess, responsibilities that come with working in a healthcare organization, and the wider system responsibilities as well. So you'll be very welcome to have a look at the standards at your leisure. But now what we're going to do is ask each of our presenters to talk about some of their own experiences in terms of leadership development and the application of leadership skills and knowledge that they have gained. So Tamika, can I go to the next slide? Thank you. So I'm going to ask in a particular order. A couple of people do have slides to present, and others are just talking generally about their experiences. So I'm going to come to Shreya first. Do you mind starting? And Shreya's going to talk for about 5 minutes about his own experience in terms of leadership development.
No worries. Thanks, Kirsten. So hi again, everyone. I suppose a good way for me to start this is, particularly in foundation years, I think one thing that I certainly didn't appreciate or realize was just how many opportunities there really are there. So certainly for those of you who have already started foundation, you'll understand, how busy it is in that clinical environment, particularly those first few months when you're starting. And I think one of the things that I found in my first few months was I could only see that I could only really see the clinical work. And what you don't realize is behind the scenes, there's a lot of stuff that goes on. So whether that's public health work, whether that's more organizational work, and even within your own departments, there's actually more than just your clinical work that needs to be done and actually is being done by other people. What I've personally found was once you get your foot in the door, so to speak, that's when you really realize that there's a lot of people who need a lot of help with a lot of things. And that's where if you're so inclined, you can definitely get involved. So an example for me, so I was working in the East Midlands. I was working at a tertiary centre, quite busy. I was on my general medical shift, and really, my first opportunity was from talking to people. So I was talking to who was my senior registrar during my night shift, and I just mentioned, I really like what we're doing, but then I kind of said, I'm looking at kind of other things too. So I was like, I've heard of these fellowships that people do, whether it's public health initiatives and things about things that are beyond just clinical care. And I got quite lucky in that my registrar happened to be doing work on that already. So he was a previous fellowship holder. He was doing active work kind of at the trust that I was at. And he said, okay, we can get you involved in something. Now, the lessons that I take from that, it's not ask everyone about opportunities and be on a night shift in particular and just hope that you get lucky. What I take from that is that there's actually lots of people who need that help, but it's about finding those opportunities. So this is almost something that I think applies for both foundation trainees and perhaps those more senior. It's people are out there and they really do want to do that work, but actually finding them is maybe where the initial task lies. And I suppose foundation doctors, what I'll say is when you first start, you get inundated with a lot of emails, particularly that first 2-3 weeks. I remember lots of emails about being a foundation rep, being a rep for this, being an antibiotic stewardship champion, all sorts of things that kind of come up. But then after those first 3 weeks, often they settle down. So what I would say is actually chase up the emails. And in fact, you don't even need that. Sometimes if you just know that someone's in a department that you like, or someone might be involved in work you want to do, actually just ask them. I think what I certainly was doing initially, I was underestimating the power of, so to speak, a kind of a cold contact. So just asking people that is there something I could get involved in, or I have these ideas and I really want to implement them. Is there something that the hospital or department or ward's already doing? You'll be very surprised how many doors you can open up that way. And what I can say is from my own experience is that that initial opportunity that I got, I then became an ambassador for a charter kind of in my region. I then did some work furthermore with an education company. Those experiences then allowed me to apply for the fellowship I'm doing now, and then this has given me more opportunities. That's not to say that I'm particularly special. I don't think so. I think I got very fortunate. But what I'm saying is that if you're able to get your foot in the door, you can very easily kind of see that path open up for you. And I'd encourage anyone who really is keen on leadership. It's like with any other job. If you try and find it, eventually you will find something. And once you get that opportunity, then make the most of it. And then you'll see that people will actually come to you because you've proven yourself that, yes, I can do this. Yes, I have experience in this, whether it's through quality improvement, whether it's through kind of other ventures. And, do the work honestly, do it to the best of your ability. And like with any other career, like with things in medicine in general, things will open up for you. So I suppose my kind of takeaway point for everyone is look around, and actually there's more opportunities than you do realize, even if they're not quite there in front of you just yet. Hope that's okay, Kirsten.
That's great, thank you. I'm just wondering if you have any advice for people that might be viewing this that are responsible for the training and supervision of doctors in training about how to facilitate those opportunities too.
Absolutely, and I think I do have sympathy because I think people are trying. I think it's just we need to make sure that people are finding the people they need. So emails are certainly helpful. I think especially after that first month, because I think it's fair to say when people first start the job, that first month really is a teething process. It's very nerve-wracking, and I think understandably so. But I think whether it's weekly, whether it's every 2 weekly, emails is a good way to start. But I also think having some open dialogue. So sometimes at the end of a ward round, certain consultants or certain registrars will just mention projects that they're doing, and they would ask us if we're interested in doing it. Now, that's not feasible every time due to workforce pressures, but I think things like that and maybe having a culture where it's very normal and open to talk about this, I think for me, that's what I found very helpful. So that's probably what I would do.
That's great. Thanks so much. Okay, I'm going to come to Josie now. Hopefully we've got sound all sorted. And Tamika, Josie's got 2 slides. So if you wouldn't mind bringing the next slide up, that would be great. Thank you.
The big question, can you hear me better now?
It's still very faint, so maybe need to lift your volume a little bit. Tamika, it's the next one.
I literally can't change. I've changed all my settings. It's wrong with my computer. I'm so sorry. Is this comprehensible? Because I don't want to your time off.
Yeah, we can hear you. It's just soft. So yeah, please go ahead.
I'll try and project my voice. So this slide really exemplifies. I really wanted to show this all to you. How I feel really leadership is for everyone. It's for everyone. First day of foundation doctor training. And I feel that you don't have to be a particular personality. Leadership actually thrives on having that diversity of personality, interests, and things like that. And you can dip in and out of things as and when you're playing higher, when you focus on portfolio and so forth. So I hope that this slide really exemplifies. I've kind of mixed and matched what I've done in my leadership journey. Some of this is after foundation years. Focus on the foundation doctor years too. And really, when I was thinking about this actual webinar, I was thinking how probably for the first 4 or 6 months of my foundation year 1 placement, I was actually starting to undertake leadership activities. I didn't realize they were leadership activities. I just wanted to be involved with change, to make improvements. And so I picked up some of those emails. I think that Shez has been talking about in my day, as it were. There weren't that many emails around. So I picked up an email for a few junior doctor representative roles within my trust, which were the inaugural. And I went to these committees. I didn't know what was going to happen, and I just kind of shared my enthusiasm and ideas for as being a junior doctor. And I was really stunned by the way these very senior clinical and non-clinical leaders really listened to my viewpoint, kind of opened doors and facilitated my suggestions. And I ended up doing a few trust-wide and then regional-wide projects as a result of that. And it was, as I said, only about 6 months in that I actually realised that this wanted to be part of make improve leadership. And then since after that, in my foundation training, I came across emails that looked really interesting in terms of being an HEE trainer representative on placement quality standards, advisory group, and then the steering group, and also the National Education Training Survey. You can probably tell how long ago I did the foundation years, so I was on the steering group for that too. So that was my first experience of actual national leadership, going into these huge rooms, you know, with probably over 100 very eminent senior leaders, was really fascinating and interesting, meeting all these different people from different viewpoints, but we're all coming together and actually making things better by our contributions. And I just really took a lot of inspiration from that. Again, I was, you know, always kind of monitoring my emails, looking at, say, Royal College websites and things like that. And I saw a new group being set up by the Royal College of Physicians called the Student and Foundation Doctor Network. And they were advertising for reps. So I applied to be one of their inaugural reps. I think that was my most enjoyable leadership role thus far in my career. So I ended up being what we call Working Lives group lead. So we worked on policy and report in terms of how we could improve foundation doctor working lives and training conditions. And again, that was working with colleagues across the UK, but it was also working with non-medical colleagues. So really, really interesting people in the RCP who come from very different backgrounds, say charitable sector and things like that. Really, really broadened perspective and really challenged the way I thought about things. And that was the first time I came across the FMLM actually, because we encountered some of their clinical leadership fellows. And again, I looked at a newsletter I saw that RCP was running a survey on adverse drug reactions and junior doctor prescribing, and that was one of my passions. So I emailed the RCP and asked, I said, if you need any other junior doctors involved, I'm really keen to. And actually they reached out and I became part of the group that actually brought that report that's called Doctors in Safe Prescribing, and I think it's the most popular still on their website. And again, through that, I was exposed to different people, different experiences, learning to design kind of pitches, business cases, how to summarize something and kind of really promote things to different people with different concerns, and thinking about the patient experience. So those were my real fundamental roles, I think, within my foundation years. But actually, some of the things I really enjoyed alongside that were not the formal roles. It's the day-to-day leadership that you're all doing at the moment as foundation doctors. It's actually leading a ward round, coordinating over, your and maybe your outlier ward, being on call and actually handing over clearly and competently to your colleagues, and working in a team, for instance, a cardiac arrest, another situation, and indeed in terms of quality improvement. And I really think leadership is for all, because there are so many different facets that you can actually take forward leadership within. If you're interested in green healthcare and healthcare sustainability, if you're interested in digital health, entrepreneurship, there's so many different ways of leadership. And I'm by no means a very gregarious person. I'm not the cardinal definition of an extrovert, but I really believe that leadership needs personality. So even if you don't feel like a leader, you really can be a really excellent leader. I hope you can actually hear what I've said, Kirsten.
Yeah, we've certainly, there's been the odd word that is missed, but most of it absolutely fine. Thank you, Josie. Tamika, do you want to just show the next slide? Because Josie did have one just about the Trainee Steering Group, and that has a number of relevant pieces of information. Josie, do you want to mention any of this?
Yeah, so as part of my role as TSG chair, I just wanted to kind of highlight what we can offer you. So the whole mission statement of the Trainee Steering Group within the FMLM is to highlight the real value of trainee leadership from the first day that we get to the last day before. And also to provide materials and resources that make it easier for you to access this development, and also actually encourage organisations, systems, teams, senior doctors, and other NHS staff to actually open that door, that ladder down, and actually elevate us so that we have those opportunities. So this is just a selection of what we do. We hold a range of essentially a series of free leadership webinars. You can go to Medal and you can see our back catalogue. The last one we did was on international medical graduate leadership, but there's plenty of different ones there, and I think Kirsten's going to talk about a couple of. We've got toolkits in terms of how you can start up a junior doctor forum or equivalent. It doesn't have to be about contractual conditions. If you want to set one up to do with other spheres, that's absolutely fine. We've got case studies about trainee leaders, and I think they're fascinating, how they see themselves as the leader. We've conducted surveys and reports data of trainee leadership to really challenge this about that. And we've got how-to guides. For instance, if you're asked to chair a meeting for the first time and do I chair a meeting, I've seen people do it, well, we've got a how-to guide for that, and we're always looking for other suggestions. And also we collate opportunities, try to share opportunities that we know of regions within the UK, and also for foundation doctors, medical graduates, and so forth. And so I definitely encourage you to look at our web pages and also keep in touch with us to actually direct our work based on what you.
Brilliant. Thanks, Josie. Yes, I would really encourage the Trainee Steering Group do all of this voluntarily and do some great work. So please do visit that if you'd like to learn more. Tamika, if you could just close the slides for a moment, because I'm going to come to Jamie to talk a little bit about his own experience, and then we'll come to Priya in the next slide. So Jamie, over to you.
Cool. So I'm just going to talk, I guess, a bit more generally about my experience. I don't have kind of a scripted talk per se, but just to kind of give me opportunity to kind of reflect on some things that Josie and Cherry have said already. I think I wanted to start with that at no point in my medical career did I say at any point that, leadership's what I'm interested in and leadership is what I want to do. I didn't start thinking I'm going to seek out leadership opportunities, which is odd given that, as I said, last year I was sitting in a national leadership clinical fellowship program, and it's quite hard to accidentally fall into those. But through my training, so I did foundation training, I did an FY3 year, then I did internal medical training before then doing the fellowship and now ending up in public health. And at no point was I thinking, right, I want a leadership position or I want leadership expertise for the sake of leadership expertise. Everything that kind of drove me to seek out those opportunities was very much based around how can I become a better clinician? How can I become a better doctor? And how can I do better for the people around me in the system that I'm working with, so staff, other medics, other clinicians, and then how can I do better for our patients? And that naturally really kind of is what leadership is all about. It's not necessarily, getting a national position. It's not having authority or having influence for the sake of it. It's about how you can do and use those things as vehicles to do your job better. And I think the thing that always kind of struck me in foundation training was that the best people to work with, the best fellow foundation doctors, the best registrars, the best consultants, weren't necessarily always the people that had the sharpest, most all-encompassing multidisciplinary clinical acumen. It wasn't the foundation doctors who had the Oxford Clinical Handbook memorized front to cover, who could be able to recite the whole, every physiological pathway and every drug interaction. The best people to work with were actually the people who could use, a degree of that, because it's important, but be able to actually work well as part of a team, be able to get the best out of the people they were working with, make the people they were working with feel safe and supported and secure. Those are the consultants and the registrars that I felt, myself gravitating towards. And those are the people who were naturally displaying good leadership. I know some people would go further to say, people would say, well, I've worked with people they're not great people, but they're great surgeons or they're great physicians. Well, arguably, if you're if you if you're not a great person to work with, you're probably not a great surgeon or a great physician, because you're putting up barriers around yourself, you're putting up barriers around your team and making that harder to do, so those Swiss cheese things happen more often. So that's what kind of led me to these opportunities. And I know that we have a panel of people here who've either hold national positions or have done national training positions, but actually leadership isn't so much about those, it's about what you do in the day-to-day. And that's where the resources that Josie has just talked about in the Trainee Steering Group that they've produced really come to the fore, because having those resources to show you how to be a better doctor on the day-to-day and how to become a better leader is really vital, and helping to challenge that idea that being a leader is having a position. Because great, some people here might want to be the next Chris Whitty, you might want to be the next Stephen Powis, you might want to be that next national title holder for one reason or another, but there's one there's one job going, so the competition is going to be pretty stiff. So actually, the best way to be a good leader is to do what you can where you are, and to improve the conditions around you, whether that's the workforce conditions, like training conditions, because speaking candidly, we all know that they could do with a fair bit of improvement at the moment. Or improving things for patients through quality improvement projects, and seeing those as more than just a tick box exercise you do for your ARCP or your foundation certificate, but actually seeing them as a very fundamental way, when done well, to improve health. And that's what led me to take up the opportunity of doing the National Medical Director's Clinical Fellowship. But while those opportunities are great, those opportunities are so few in number that actually, realistically, we can't train every clinician to be a leader through models like that, because the numbers of positions and the funding just isn't there. Actually, what we can do is we can continue to try and improve what it means to be a clinical leader, and give that recognition and the structure that it needs. And that's where work the FMLM comes in and is really, really important. So having standards, like how you have a medical school curriculum or a foundation program curriculum, having a leadership curriculum that goes through those domains as a structure by which to grow and develop is really important. So through my career so far, I've sought opportunities to develop those skills. So whether that's through being a training rep and through being an associate college tutor when I was in IMT, and to even just looking at ways. So that's what led me to do a public health master's degree, because that involves a lot of teamwork. That involves a lot of leading people who you don't necessarily work with on a day-to-day basis and learning how to navigate those softer skills. And that's ultimately what kind of led me to following a specialty training program in public health. And leadership is what ultimately you make it. I mean, Josie's slide really, really clearly defines that, is you can have very kind of different career pathways within clinical leadership than that you might not necessarily get otherwise. And some people who are in leadership will regularly tell you, I didn't mean to fall into this. This is a happy accident. And I think that's a lot of what leadership clinically is. So I guess the take-home message for what I'm trying to say is that don't seek out leadership for leadership's sake. Seek it out because leadership is something that will make you a better foundation doctor. It will make you a better registrar. It'll make you a better consultant with everything that you do. Find opportunities to build that leadership in your day-to-day career, and use the resources that the FMLM offer through the person specifications to the Trainee Steering Group resources. And yeah, as Sherry said, being able to reach out for opportunities is important, but it doesn't necessarily have to be big national roles. Start small, try and build up things that way.
That's brilliant. Thank you very much, Jamie. Ria, I'm going to come to you. And the reason why we've asked Ria to be part of this presentation, even though it's still yet to step into the foundation year, actually leadership development begins much earlier. It begins at medical school, or frankly, it begins much earlier in life, really. You're developing some of these skills as you grow up, but actually helping medical students in terms of developing their leadership to before they make that transition into foundation training we think is really important. So Ria is one of our co-chairs of our medical student group, and Tamika, Ria has a slide, if you don't mind bringing that up. Ria, over to you.
Thank you, Kirsten. I think I was just going to start off by saying that all of the presenters have alluded to quite relevant things, and it all starts with a strong foundation in leadership in medical school. And so this slide is sort of supposed to bridge that gap in terms of, like some of the presenters said, that foundation year starts off with you not realizing that there's lots of opportunities around and being quite inundated with lots of clinical work. But I think this is a bit of a summary slide of what you can do in medical school and how that's really transferable as early as trainee or a foundation year doctor. So I think when you start off in medical school in your early years, it's a lot more about developing your own personality, learning about your own character and personality and the others that work around you, with sort of navigating a new professional relationship and environment, bearing in mind that your future decisions and actions are going to impact patients' outcomes. And so it's all about working towards your clinical competency while also developing commitment to the job and your character. I think lots of medical students do this by way of getting involved with societies or embracing a certain cause, and some will start pioneering new initiatives. But I think through my experience and other peers, something to take away from that is that it's less about the number of societies and initiatives you get involved with, but rather how you grow through those leadership positions and see those through completion. So lots of people will get involved with many things and don't actually see that through to completion. So I think that was a big takeaway for me. And I think this is really transferable to as a foundation year, when you don't have, like Jamie was saying, the big one-off opportunities to be at a national position. I think it's really relevant if as a trainee or or a foundation doctor, you do things like be an advisor to a society you started when you were in medical school, or a similar society in sort of the deanery or the university hospital you're affiliated with. And that's a really good way to start getting involved with helping to facilitate sessions in medical schools that you've previously been involved with, already organising and delivering. And I think it's really useful for us as medical students as well, when you've got someone who's just started out in their foundation years, who can relate to you, but also has the clinical competence to sort of see those sessions through. I think as a more senior medical student, there's this role for mentorship that comes up, and lots of people will do it informally just with their peers or their immediate juniors. But I think this can also be done in larger ways, such as organising conferences or delivering teaching sessions, which some people will do as senior medical students, because it gives them that opportunity to take on bigger responsibility and interact with so many more stakeholders. But I think as a foundation, you're a trainee, if you start in an audit, or you start a focus group and things like that, I think it's a really good opportunity to involve more senior medical students, so that they have a chance to get involved with things that they're unlikely to be able to start themselves, but it would give them sort of a bridging opportunity to get involved with these things that they can then continue the cycle when they become a foundation trainee and take on those audits, and things like that. I think towards the end of the course, or even as a foundation trainee, one can start thinking about qualifications to help formalize their leadership skills and experience. And most of our presenters here have involved themselves with those, such as getting involved with a fellowship. The FMLM does some of these fellowships, as well as other qualifications, like the ILM does modules and programs in different levels of leadership. There's the Mary Sequels, so some of the NHS leadership programs, and then some people will even choose to do diplomas or masters in medical leadership, because it helps them upskill their management skills when there's more opportunity to take on that sort of responsibility and leadership as a postgraduate. So that's everything from me. Thanks, Kirsten.
That's great. Thanks, Ria. You think you've really pointed out, I guess, the importance of foundation doctors always having that sort of mentoring, sort of peer mentoring, sort of support supervision sort of capacity for medical students that they encounter in terms of their rotation, but actually how everyone is starting to develop these skills as they are going through medical school, and there's something about building on that. So thank you so much, everyone, for your presentations. I'm going to come back to each of you for a top tip. If you were going to leave people with one thing today, what would you suggest? So I'm going to come back to you in the order that we started. So Shreya, please, you first.
Oh, that's tricky, Kirsten. I think the top tip is just ask, and you never know what you might get.
Excellent, great, thank you, Josie.
Yeah, that's really difficult one tip. So I think pace yourself in multiple different ways. So choose things that you're really interested in, that inspire you, that give you energy in terms of leadership. Take one on, take two maybe activities on, but prioritize your own well-being and prioritize your own reflective time in your training as well. They all work together and you're developing a leadership. So pace yourself.
Great, good advice. Jamie.
For me, I think find your people, I guess, is the core takeaway, is trying to find the people who are angry about the same things as you, whether that's, things, shortcomings in the way that your workplace is going, ways that you can improve patient care. Find things that irritate you. You'll find things that whatever irritates you will also irritate other people. And then similarly, find people who can mentor you in it. Like if you're applying for a competitive specialty, if you were applying to be an ophthalmologist, for example, you wouldn't dare and not have an ophthalmology mentor, either a registrar or a consultant who's done that process before and can help coach you through the process. But we don't do that so much for leadership and training and development. I think that's a real shame, and I think that's a really good way to develop those other kind of leadership skills, is learn from someone who you admire in that respect. So yeah, find your people, both people that can teach you and people that can work with you to help implement some of the things that should be better.
That's great. Thanks so much, Jamie. Ria.
Yeah, I think for me, it's start early and seek opportunities. But when you become a foundation doctor and a trainee, try and continue that cycle and provide opportunities to your juniors as well.
Fantastic. That's great. Thank you very much, everyone. Tamika, we're just going to go to the next slide, and I'm just going to highlight some of the research that underpins all of this and why it actually matters. And then we'll open up for a Q&A. So please, if you do have any questions to put to myself and others that have presented today, then please do that. People often wonder, why does leadership matter? Why does it matter that I actually sort of spend time sort of developing these skills if I'm not yet in a more sort of senior leadership role? And Michael West, who some of you might be aware of, has published and researched extensively on both leadership and teamwork. And he would say that leadership really is the most influential factor. So, every interaction with every leader every day shapes the culture of the organization and communicates its values. And I think we'd probably go on to say that every interaction with your patients is and with your colleagues is a leadership or management interaction as well. So these skills matter, no matter whether or not you hold a formal role or not. But there's lots of research evidence that shows that actually at a fairly senior leadership level, how effective the leadership is and who's on the leadership teams has an impact in terms of how organizations actually perform. So, and particularly perform in relation to things that really matter for staff and for patients. And we will send these slides around and you'll be able to have a look at some of these references in more detail. But there are strong relationships between particular practices that you would employ as a leader in terms of like appraisal and training and team working, and actually how that relates to patient mortality. So the individual interactions as well as the more formal processes actually really matter. So making sure that you're getting the best out of your the feedback that you're getting and the training opportunities and the opportunity to develop that teamwork will make you more effective, which will have an impact in terms of patient care. But one of the things that comes up repeatedly, and not wanting to focus on sort of the negative, but when we see organizations that hit the media because of really poor patient care, repeatedly the investigations into what happened highlight a lack of clinical leadership in particular. So there is something really important about clinicians, including and particularly doctors, getting actively involved in the leadership of health services, because it makes a difference. Tamika, next slide, please. And I'm just going to talk about sort of medical leadership in particular, because everyone on the call, I think, is doctors today. But there has been a lot of research about doctors, particularly in sort of senior leadership roles, but there has been at other levels as well. But where there are doctors, and particularly where there are a larger number of doctors in senior leadership roles in organisations, and this is the research not only in the UK but also elsewhere, they find that those organisations perform better on measures such as engagement, staffing, organisational performance, both quality and financial performance. And there's a lot of assumptions around about like, why is this? Because the people that do these pieces of research try and find out, well, what is it? What is it the difference that doctors are actually making in terms of enabling these things to take place? And they talk about the combination of this deep knowledge and experience on the front line in terms of patient care being a really important factor. The fact that they've got credibility with colleagues and that sort of that depth of understanding about how things actually work in practice can really affect decision making, and it also matters in terms of engaging colleagues as well. And there's a particular term called hybrids, and these are people that occupy both clinical and leadership roles in a more formal sense. But because of operating in both the kind of clinical arena as well as a sort of leadership arena, people kind of go beyond the boundaries of just their clinical practice, and so create those connections with other people and those different opportunities, which has an impact in terms of the organisation's capacity to do particular things and to improve the quality of its services. There's also research that shows that there's particular activities that doctors, particularly in senior leadership roles, do in terms of translating between sort of the policy or the organizational strategic sort of, plans and what this actually means on the ground in terms of the clinical work that goes on in organizations. There's a lot of diplomatic work, seeing medical leadership as a diplomatic exercise in terms of engaging with not only other doctors, but other clinicians, both within the organisation and also external to the organisation. And there's repair work as well for organisations, particularly that have encountered sort of challenges, and there's been a lot of system change. There's a lot of repairing of relationships that often needs to go on. So these are all really important leadership skills that you pick up sort of through your training. But organisations that actually do have greater levels of medical engagement have a number of very positive benefits, is what has been found in the research. I could go on, but I won't, because we've got 10 minutes left and we want to give an opportunity for some Q&A. I've just got one more quick slide just to highlight some of the resources that are available. So Tamika, can you just, thanks. So there's a number of resources that we've got. Josie's mentioned a few of these before, and there's also some guidance specifically that we've developed for supervisors, educators and trainers that you might want to take a look at if you are a supervisor or educator or trainer, or even a foundation year doctor, to get more information. So we'll send this around afterwards. But Tony, shall I hand back to you to compare the Q&A?
Thank you all very much. My experience is that often the questions start to roll in as people have a few moments to digest it. So I will just sort of fill the space by thanking you all for your presentations and insights. I was particularly struck by this idea of starting early, but pacing yourself. I mean, it is a frantic time in foundation. I'm just going to give a little bit of advice from somebody who's been involved in foundation for a while. Do seek out those opportunities, and the idea of finding, somebody you admire as a mentor. You'd be surprised how easy it is to approach somebody, actually, or once you've got over that initial hurdle of approaching somebody, how welcoming many senior doctors are. They're more than happy for you to sort of share their workload a little bit, and and don't be shy to ask, because you may well learn quite a lot, and you'll get that mentorship. From the foundation point of view, just a reminder, the portfolio is a way of recording your leadership, and it's not only there to help you pass your ARCP, it is there as a portfolio. It is your opportunity to fill it up with useful things, and when you do attend the interviews for specialty training or whatever you choose to go into, there's always the area of leadership that it's always on the application process, because as people progress through the medical training, they do take on more responsibility, whether they want to or not, really. And just a couple of quick plugs. The National Foundation Doctors Presentation Day happens every January. A great opportunity to share your work and the kind of things you've been doing. It is open to clinical work, but it's also open to improvement projects. It's open to educational projects and a variety of things that foundation doctors have done, and that's a great way of demonstrating some of your work and getting it on your CV if that's something that you're very interested in. And the final thing I'd like to say is that I had a brilliant morning interviewing for the UK FPO Leadership Fellows, and we advertise this every year. It's a great opportunity for F2s to get some leadership experience, get some national experience working for the UK FPO. So do look out for it. We always have a huge number of applicants. We tend to close the application process once we've got 100 applicants. We shortlist it down to 10, and as I say, I had a fabulous morning interviewing those 10 this morning, and we've got some great fellows for next year, and we've had some great fellows this year, so fabulous opportunity. I'm still can't see any particular questions coming in, so I think I may just have to say that you've wowed the audience. There's an awful lot of material out there that people can follow on listening to. This webinar will be available on the website in a week or two, and we do get a lot of hits on the previous webinars, so it will be there. So once again, thank you all very much, the FMLM, for coming in. I greatly respect your work. I've attended a number of your national conferences. I think a great organisation. It's lovely to have you sharing some time with the UKFPO. Thank you too to Tamika and Sophia behind the scenes, who've made all this work. And once again, apologies for the late start. But anyway, thank you all very much. And I'm going to close the webinar now.
Thank you very much.
Thanks, everyone.
Bye.
Thanks, everyone.